Hi guys, welcome back to Wellness Wednesdays. Today we're going to talk about cold therapy and nerve damage. Does it really help or is it causing more harm than good? Let's find out. As always, big thank you to my research team for putting all this together for us. And if you like the content I'm putting out, please do like and subscribe so you don't miss any Wellness Wednesday videos. The first things first, what causes nerve pain? So nerve pain, also known as neuropathic pain, can have various causes and often results from damage or dysfunction in the nervous system itself. Now, we already know that cold therapy helps activate the parasympathetic nervous system. So there are a lot of different reasons that you could have neuropathic pain, such as nerve injury, nerve compression, diabetes, of course, diabetic neuropathy we've done a video on before, infections, autoimmune disorders, medications, alcohol use, nutritional deficiencies, toxins and chemicals, and idiopathic neuropathy. Basically, idiopathic neuropathy is unknown neuropathy, as in they don't know what is causing it. In some instances with nerve pain, you would want to use heat instead of cold, such as if you're having spasming or things like that to help relieve the muscles as well as the nerves. Cold therapy, however, is more effective for acute injuries or conditions that involve inflammation, swelling, or recent trauma. And this is where it becomes useful for nerve compression. Now, one thing to note is that coldness can sometimes make the nerve pain seem worse for more people, which is important to note. This is referred to as cold sensitive neuropathy. This is most likely caused because coolness makes blood vessels narrower, reducing blood flow to peripheral nerves. This reduced blood flow leads to decreased oxygen supply to nerves, potentially increasing pain. The cold can also make the nerves more sensitive, causing them to transmit pain signals faster. So essentially what all this is telling us is that if the nerve damage is associated with any kind of inflammation, like injury or autoimmune disease, cold therapy can absolutely help. Now, depending on what causes your nerve pain, it might make it worse. It might make it worse temporarily, or it might make it worse long time. So in conclusion of this study, yes, cold therapy is great for certain types of nerve damage, but not necessarily all types of nerve damage. A lot of the other studies that we found all suggested the same thing, that cold therapy helps with pain damage because it is anti-inflammatory and a lot of nerve damage stems from inflammation. There's one study we did find that said that nerve pain treatments with cold therapy, similar to migraines, could get progressively better over time. So similar to migraines, the first time you do it, it's going to help a little, and then it's going to compound and compound and compound every time. Now, this is something that I have experienced. I started ice therapy because I have nerve damage in one of my legs where my skin feels nothing. It's numb, but my muscle feels everything. So it's a weird contrast that happens. And it would get to the point where I couldn't even stand clothing touching my leg. And now with cold therapy, I'm able to actually touch my leg, get through the day without any problems or any pain, anything like that. So the long and the short of it is, guys, as long as your nerve pain is triggered by or suspected to be triggered by any kind of inflammation, yes, cold therapy is absolutely going to help. If it hurts, it's probably worth talking to a doctor or looking at your diet, medication. There's a lot of other ways to treat nerve damage, such as vitamins, minerals, things like that. So if you find you have nerve damage and the cold is making it worse, probably a good time to seek outside help. But if it's helping, you're probably fine. It might take that area a little bit longer to warm up, as we found with diabetic neuropathy, but it shouldn't be causing any more damage according to any of the studies. We are going to link more studies than usual down here just because we only really talked about the one, because the rest of them, like I said, basically said the same thing that we've already talked about, but every study we looked at is going to be linked in the description below. And of course, we can't talk about cold therapy without talking about Ice Wellness. Our Ice Wellness program was designed to help you find what's working for you, what's not working for you, as far as time, temperature, duration, time of day, etc. There's a lot of mixed information out there about what's the best way to practice cold therapy, and realistically, because we are all different and practice it for all different reasons, the best person to tell you how to practice is your own body. Our journal is designed to help you track what you are doing, and our program is designed to help you feel like you're participating in a group plunge if you don't have availability for a group plunge, get you out of your head, get you more intentional with your cold plunging. And of course, our post plunge workout is designed to help you naturally warm up without taxing your body or jumping in a hot tub or hot shower and negating the benefits altogether. Now, we're not saying contrast therapy is bad, but you always want to end on cold if you're doing contrast therapy.